Our people are talking about the joys of living and working in the Fox Cities region of East Central Wisconsin and the myriad of opportunities within ThedaCare, the state's #1 ranked healthcare network for quality. 7 hospitals, 33 urban, suburban, and rural clinics, and invaluable physician and specialist collaborations make ThedaCare an exceptional employer of choice to care providers and their colleagues. Listen in as our team members tell you why they chose to join ThedaCare.
Went to St. Olaf College undergrad and also went into family practice. So I did my family practice residency at St. Michael Hospital down in Milwaukee, northeast side, I guess, of Milwaukee in 80 to 83.
My name is Greg Devine. I'm Senior Vice President for Systems of Care. I've been with ThedaCare now over 25 years.
My current title is Senior Vice President of Physician Services, Behavioral Health, and Transitions of Care. And I've been at ThedaCare for approximately 22 years.
My role is Chief Medical Officer and Senior Vice President for Systems of Care. I started as a family physician out in our Kimberly office.
I'm a nurse practitioner, family medicine, and I've been with ThedaCare for nearly 6 years.
Well, I'm brand new. I've been working 2 weeks now. I'm a family physician over at the Mayo Clinic.
My name is Dan Sutton. I've been a family physician with ThedaCare since September of 2011.
Went to Case Western Reserve University for undergrad. Came back to Wisconsin to go to the Medical College of Wisconsin. Did my residency in Milwaukee and then came back home to the Fox Cities to practice medicine.
I very much enjoy my career at ThedaCare. I get constant reminders that this is the right place for me to be, the right organization, the right role. I find work-life balance very easily. My associate providers, physicians and nurse practitioners and physician assistants really support me and my true desires right now in life.
I chose ThedaCare because it was very friendly to primary care. There was a strong group of primary care physicians here, and one thing I looked at is how happy those providers were. And I found out that when I came, there was only one provider that had left a group of 24, and that provider actually came back to the area some years later. So to me, that was a testimony that it was a very good place to practice medicine, and in my case, family medicine.
And as far as the organization is concerned, coming straight out of residency, ThedaCare appealed to me because of its commitment to good value, evidence-based medicine, process improvement. The other thing that really stuck out to me about ThedaCare was that it's physician-led and that physicians are part of the organizational structure and decision-making process, and we're involved in decisions that impact us on a day-to-day basis.
ThedaCare is a great organization. I think it's one of the most progressive healthcare organizations in the country, actually. It's very well known for its lean principles, its commitment to high-quality care, affordable care, and just filled with leaders in this healthcare area where we're going to have so many changes in the future, and I think this is just a great opportunity for me personally, and I think anybody in the organization to just learn from each other and just be the best physicians and leaders we can.
We work very well together. We've attracted a lot of talented people who are passionate about their work. They enjoy engaging in that work with other folks in this organization, and together they really are delivering a very, very exciting and beneficial program for this community.
Choose to live in the city or the country without traffic troubles. Pursue your passion for sports, fine dining, Broadway shows, or the outdoors. And yes, it's true, Wisconsin is known for its warm and friendly residents. Whether it's your neighbor, someone you've just met, or a fellow sports fan, you'll find no shortage of friendly faces.
I love the fact that people have a high value on family and on community. We've got lots of quality schools, but we've also made investments both in public and in private schools with new high schools for almost all of them, almost every school district in the last 15, 20 years.
The people are friendly, the place has so many things to do. My wife and I love to do outdoors things. There's lots of restaurants, there's things you can do at night, live music. It's just a great place to just live and be happy. You know, my wife and I were at the coffee shop the other day, just struck up a random conversation with someone in line, you know, and they offered to pay for our coffee because they knew we were new to the city. You don't get that in Chicago, you don't get that in New York.
Great place to raise a family, great schools, plenty of opportunities for physicians. I'm into the outdoors. I love doing boating and hunting and fishing, and we have great resources and opportunities available for us here.
I really love the community that I joined. It's a small community, but it has a lot of opportunities. There's wonderful lakes and a great state park and some nice biking and hiking trails. And it's close enough to slightly bigger areas. It's close enough to the Appleton area, to Stevens Point, and even to Madison and Milwaukee.
This is the only place that we looked in the state of Wisconsin, even though I was from Michigan and Ohio, because it was very favorable to practice medicine here. We still like the change of seasons with its fall and winter and summer and spring, so it was actually ideal from my perspective in all aspects, both personally and professionally.
I'm also very close to where I am at home, so I have a short commute. I never am stuck in traffic in this part of the country, which I thoroughly enjoy.
If you like sports, we have all sorts of sporting activities. If you just want to be a spectator, you can go up to Green Bay, 30 minutes from here, and watch the Packers. You can go an hour and a half south and watch the Milwaukee Brewers. We've got the Fox Valley Performing Arts Center. And this past weekend, we had Mile of Music, Mile 2, where we had tens of thousands of people for 4 days up and down the city of Appleton for a mile long, 200 artists for music. So we turned Appleton into Nashville, Tennessee.
ThedaCare is widely known and respected as a progressive organization deeply committed to continuous improvement. One shining example is the Wisconsin Collaborative for Healthcare Quality, or WCHQ.
ThedaCare was instrumental in the founding of WCHQ. In order for healthcare to be improved, the information has to be available, it has to be measurable, it has to be independently validated, it has to be transparent. And ThedaCare was instrumental in bringing all of that together.
When we started WCHQ, it was just a dream. There were 7 organizations in 2003 that got together and had a series of meetings. And out of that, we said, you know, if we create an organization where we can all know how our performance is versus each other, all of us will know that we're not going to be the best in everything. We're going to be good at this and not so good at that. But once we know our performance and we can see other people that are better than us, we can call them up or we can start to work on it, and then we'll all improve care.
ThedaCare works to create these protocols or processes to help you be the best doctor you can possibly be.
Most importantly, working for ThedaCare means you join a team of dedicated and energized people who care about patients and working together to discover the best ways to deliver quality.
ThedaCare is very much moving forward, I think always introspective about where they're at, what they're doing well, which we celebrate, and where we want to be. I never see the organization stop moving. I am at a very large clinic and kind of central to a lot of the ThedaCare improvement system, so we see it, live it every single day.
My father worked in a completely non-medical field, but he was involved with some of the business administrators through ThedaCare from a leadership seminar he was involved in, and so he had told me some of their, really forward-thinking business practices, and so I just was excited to be part of in a changing medical environment, to be part of a progressive, forward-thinking healthcare system.
We're an organization that is innovative and creative and are continuously looking for new opportunities and new ways to do things and new ways to partner with folks. That also adds to the challenges in making things work, challenges in being successful, but it makes it exciting, and I enjoy it.
Appleton might be 75,000, but really the total service area is, a good million, population, and the types of services that we have in this community, plus the access to specialists and the quality of specialists in this community is just outstanding.
Is a rural clinic or hospital the place for you? Our rural clinic physicians appreciate their autonomy and the connection to the larger ThedaCare system.
So we are spread out over a large county area, probably a 60, 70 mile radius, and it allows people to find a practice that fits what they're looking for. So they can be in a site where there's 25 primary care physicians, or they could actually, we have a few solo physician sites, and then many others that are in between, from 3 or 4 or 5 physicians to 10.
My position there in rural medicine, and it's really blossomed, and I've enjoyed my time there. I've had the opportunity to perform procedures and take care of patients which may have otherwise been dealt with by a specialist or other provider in a larger setting. I've had the chance to take care of mothers and fathers and their children and sometimes their parents, so it's wonderful to take care of generations of families.
In my time at ThedaCare, I know we've definitely acquired more small hospitals, more rural clinics, and I think that's really exciting that we're not just focused on the suburban population. I can imagine that the families, especially the multi-generational families in these small towns, from the young children to the elderly patients, have to find ThedaCare moving into very rural settings to be a great benefit.
Wherever your location within our system may be, ThedaCare physicians work in a collaborative and connected culture.
So the region we're in is generally northeast Wisconsin. The 2 main hospitals are Apple Medical Center and Theta Clark, and each of them has about 160 hospitalized beds. We have 5 surrounding rural hospitals, which are all critical access and have various level of physicians and resources. One of the great things about that, though, is wherever you are, it's all connected electronically.
I'm part of a clinic where there's 7 other docs, part of a larger call group where there's 13 docs, and then part of the larger organization where there's about 120 primary doctors. There's also plenty of opportunity for us to get together on a regular basis. You know, we certainly get together at each other's homes, we interact with each other's children. Every spring and fall, I used to have to help Dr. Spencer back his boat into the water because he couldn't do it on his own.
I had support from nurses, staff, physician providers instantly, and we continue with a great relationship. So first and foremost, the people you work with will definitely make your day better and help you support what you're trying to do, which is improve somebody's health care.
As the first Wisconsin member of the Mayo Clinic Care Network, our doctors also have access to Mayo Clinic specialists for consults and additional medical research.
So the Mayo Clinic Care Network allows us to interface with Mayo electronically. So for those really tough or complex patients, or those patients who we haven't reached an answer that satisfies them, we're able to reach out through our specialist colleagues and request e-consults. Essentially what that allows is our patients to have their medical record, tests, imaging reviewed by a specialist at Mayo, and an answer sent back to us electronically, hopefully saving them the trip of driving over to Mayo and actually having to be seen in person.
The relationship that we have with the Mayo Clinic through the Mayo Clinic Care Network has really offered another area of expertise that can give comfort to our clinicians as well as our patients that they're on the right care path with the care that's being provided here locally. And better than 80% of the time, the patients and the providers get confirmation that they are doing the right thing.
Continuous improvement, a culture of learning, a strong, growing healthcare system. All of this, and it's surrounded by a welcoming, beautiful community.
But there's this insatiable urge to still get better. So it's very much an improvement mindset. And the good news about this, we've been able to do this and not create a culture of fear or blame, which is sort of the historical approach in healthcare and medical schools, is sort of a blame and shame culture. So if you want to come to a place where you get feedback on your performance and you have an opportunity to improve, this is the place.
You're invited to visit, and we hope you'll stay.